Hello, my name is Michael Uy, and today I will be going over the significance of the different types of stools. To begin, I would like to first go over what is stool. Well, stool is what remains in the body after the digestive system has finished absorbing the nutrients, fluids, and other contents from the foods that you eat to the fluids that you drink. The area that stool is formed in is in the sigmoid colon. There, the colon removes salts, nutrients, and water to form the stool. Normal components of stool consist of water, fat that has not been digested, polysaccharides, which are carbohydrates that have been decomposed into glycogen and starch, bacteria, ash, and undigested food residuals. Normal stool includes medium to dark brown in color, strong smelling, pain-free, texture is soft or hard, and is passed once or twice daily. Some different types of abnormal stool include dark black stool, sticky stool, stool that is pale light or gray in color, stool that contains too much mucus or slime, stool that is foul smelling, and stool that is floating. Some of these types are not always due to a medical condition. Each of these types can be due to the diet of the individual, an underlying health problem, or a condition that they may have. I will now talk about black stool. Black stool is not always caused by a health or medical condition. Sometimes simple foods are enough to change the color of our stool. Foods such as black licorice, blueberries, iron supplements, etc. is enough to change the color of your stool. However, if a food is not causing your black stool, then it could be caused by blood. Black stool caused by blood, which is also known as melena, is blood that comes from high up in the digestive tract, such as the esophagus or the stomach. When blood passes through the body and interacts with the enzymes in the digestive process, the blood changes from red to black. Blood that is found in or on the stool is known as hematochezia. This typically happens in the lower digestive tract. Examples are the rectum and the colon. Potential risk factors for dark black stool are liver diseases, erosive esophagitis, which is inflammation of the esophagus, erosive gastritis, which is inflammation of the stomach, peptic ulcers, etc. The best thing to do if you experience dark black stool that is not due to food is to consult your primary care provider about the issue. Up next is sticky stool. Sticky stool could be caused by eating foods that are high in fat, fried foods, fatty cuts of meat, whole milk dairy products, oils, butter, and pastries. Sticky stool may also appear as oily or greasy, pale, dark, or tarry, which indicates a problem digesting fat. A disease called Crohn's disease basically makes it so that your body has a tougher time absorbing dietary fats. Stomach ulcers or an inflammation of the esophagus could both be a contributing factor to sticky stool. There be some internal bleeding, and the blood can mix with digestive fluids to make your stool tarry and sticky. Celiac disease could also be a factor to sticky stools. For example, someone with celiac disease is unable to digest gluten. For these people, eating gluten can result in sticky stool. However, sticky stool can also be treated by drinking more water. It is recommended for most people to drink 64 ounces of water per day. Exercise may also be an option to treat sticky stool. Over-the-counter methods include taking probiotics and enzyme supplements. I will now talk about stool that is pale or light gray in color. Pale colored or light gray stool is not normal. This indicates that you might have a problem with drainage of the biliary system, which is composed of the gallbladder, the liver, and the pancreas. What gives a stool its normal brown color are the bile salts released by the liver. If the liver is not producing enough bile, or if the flow of bile is being blocked and is unable to be drained, then that is what causes the stool to take on a pale or light gray color. Pale stools can also be due to medications such as ibuprofen, birth control pills, antibiotics, and anabolic steroids. Medical conditions that contribute to pale or light gray stool include viral hepatitis, which is the inflammation of the liver caused by a virus, which can lead to liver disease. Alcoholic hepatitis is inflammation in the liver due to excessive alcohol intake, which can also lead to liver disease or liver failure. Another medical condition is called biliary cirrhosis, which is irritation or inflammation of the bile ducts and can cause blockage to the flow of bile into the intestines. Gallstones and cysts can also be another factor that contributes to pale or light gray stool, because they can block the flow of bile. Some contributing factors to pale or light gray stool that are not medical conditions include foods. Some foods may lighten the color of stool, especially fatty foods or those containing food coloring. Vitamins that include iron can turn the color of stool dark brown. Pancreas problems can also be a factor that contributes to pale or light gray stool. Diseases of the pancreas can make it hard for this organ to secrete pancreatic juices into the digestive system. This can lead to the food moving too quickly through the gut, causing a pale and fatty looking stool. Some conditions can cause pancreatitis, which is swelling and inflammation of the pancreas. This includes infections, gallstones, excessive alcohol consumption, a high-fat diet, and pancreatic cancer. Some of the causes of pale stools are not preventable. However, others are. Some forms of hepatitis have vaccines for prevention. Alcoholic hepatitis can be prevented by not drinking alcohol in excess. If the cause is unknown, work toward having healthy bowel movements by eating a balanced diet that is high in fiber. I will now talk about stool with excessive slime or mucus. The presence of mucus in the stool is a normal occurrence. When you are healthy, mucus is typically clear and hard to notice in the stool. However, if there is an excessive amount of mucus in the stool, it may be a symptom of an underlying health issue, such as Crohn's disease, which is an inflammatory bowel disease that affects the GI tract, cystic fibrosis, which is a genetic disorder that generally results in mucus that is thick and sticky. The mucus may build up in the lungs, the liver, the intestines, or the lungs. Ulcerative colitis is an inflammation of the large intestine. Intestinal infection can also cause excessive amounts of mucus to be present in the stool. Infections acquired from eating contaminated foods is also a contributing factor. Anal fissures are small tears in the anal lining and can be due to an inflammatory bowel disease. Anal fistulas occur when anal cavity heals improperly or is left untreated. All of these could be a contributing factor as to why there is an excessive amount of mucus in the stool. However, there are treatments to help with stool with excessive mucus. Once your doctor has made a diagnosis, they will prescribe treatment. Lifestyle changes may resolve the issue for some. Suggestions may include increasing your fluid intake, eat foods rich in probiotics, are supplements that contain probiotics such as bifidobacterium or lactobacillus. Other suggestions include consume anti-inflammatory foods such as low acid and non-spicy foods, or get a healthy balance of fiber, carbohydrates, and fats in your diet. Prescription medications and ongoing treatment may be necessary for people with chronic conditions such as Crohn's disease, cystic fibrosis, ulcerative colitis, and irritable bowel syndrome. Next is foul-smelling stools. Feces in general has an unpleasant odor. However, stool that has an unusually strong and putrid smell can be due to the foods that people eat or bacteria present in the colon. Some causes for foul-smelling odor include malabsorption. Malabsorption occurs when your body is unable to absorb the proper amount of nutrients from the food that you eat. This is normally due to when there is an infection present, which prevents the intestines from absorbing nutrients from foods. Infections may also cause your stool to smell foul. Gastroenteritis, which is inflammation of the stomach and the intestines, can occur from eating foods contaminated with salmonella, E. coli, viruses, or parasites. Foul stool can also be a side effect from medications, and taking supplements that contain ingredients that you are allergic to can cause foul stool. Other conditions that can cause foul stool include chronic pancreatitis, cystic fibrosis, and short bowel syndrome. However, foul-smelling stool can be prevented by changing one's diet and avoiding drinking raw or unpasteurized milk. Handling food properly can also prevent foul stool. Thoroughly cooking beef, poultry, eggs, and pork is a way to prevent bacteria consumption. Cooking thoroughly means checking your food's internal temperature with a thermometer before eating. Also, do not prepare meat and vegetables on the same chopping board. Preparing them on the same board can spread salmonella or other bacteria. You should always wash your hands thoroughly after handling raw meats or using the restroom. Last is floating stools. Floating stool is not always due to a medical condition and are not always something to be concerned about. Your stool will normally return to normal without any treatment. The two most common causes of floating stools are excessive gas and malabsorption. Malabsorption can occur when the stool passes through the large intestine too quickly. It also occurs when your body cannot process and absorb nutrients properly. Foods such as beans, milk, cabbage, apples, soft drinks, and sugar-free candies can all cause gas to be present in stool. This is because large amounts of sugar, lactose, starch, or fiber can cause gas. Celiac disease can also be a contributing factor to floating stools. This causes damage to the small intestine when gluten is consumed, which can cause the stool to float. Excessive mucus from cystic fibrosis can also cause the stool to float because excessive mucus in the pancreas prevents poor absorption of nutrients. If you have been experiencing floating stool for more than 2 weeks, that is when you should contact a doctor. However, there are some treatments for floating stools. In order to find out the cause, your doctor will ask questions about how long you've had floating stools. He will ask you about your diet and your medical history and other symptoms. If you have floating stools but no other symptoms, you could try home treatments. There's a good chance that floating stools are caused by diet and not a medical condition. Here, you can try keeping a record of the foods that you have eaten and your bowel movements, and take note if you have floating stools. When you notice them, check back what foods you have eaten recently. This can help you identify which foods are causing your stool to float. Once you identify the food, then you can avoid them in the future. Thank you for watching my presentation, and I hope you have an amazing day.